Yeah.
Hello, everybody. Is it on? See? Do we have media service?
Yes.
Okay.
So the speaker is off currently because it was buzzing. And
Okay, got it. So speakers off just.
But speak into the microphone because they're picking up the microphone.
Okay, got it.
Thank you. So hello everybody, and thank you for being here to our press conference to stop e-cigarettes being sold. My name is Vanessa, and I am a former Galileo student and a current college student at Mills College. I've never smoked a cigarette in my whole life, but know people that have. When e-cigarettes were first announced, the whole idea of smoking one became a new trend. Curious as to what these new instruments felt, tasted, and smelled like, I took my first puff in high school. The e-cigarettes were surprisingly easy to obtain. A friend from a friend sold it to me, and till this day I still have no idea where they first obtained the product. I had no idea how sweet and warm vapor followed by a little nicotine rush could be, especially when it comes without that awful aftermath of the stench of the cigarette. As weeks and months passed by, I noticed how addictive they had become. If someone had warned me about how addictive e-cigarettes would be, I never have taken my first puff. E-cigarettes were supposed to be a healthier alternative to smoking. However, they have become a lifestyle choice and a gateway to real cigarettes.
Take your hand off the microphone, please. It moves, it makes noise when you do it. I'm sorry to interrupt.
Okay.
But I want to be sure that we hear what you have to say.
Yeah.
Thank you very much.
Many college students think of vaping as something fun to do with friends, not as a product with health risks. The prevalence of vaping has grown among peers, and people would go out of their way to share them and sell them. The social pressure of vaping isn't the only reason why teens use e-cigarettes. It also has to do with how big tobacco companies market the product, which has created new addicts for their new customer base. Nicotine harms the developing brains of our youth. For example, the prefrontal cortex of the brain is very vulnerable to nicotine effects. Nicotine unlocks special receptors, molecules in the brain, and causes these cells to release signaling molecules like dopamine that helps users reach that special high. Underdeveloped brains can develop more of these receptors. As more receptors develop, the more nicotine people will reach that high.
What's your name again, please?
Yeah.
What's your name again, please?
Vanessa.
And do you want your last name, Vanessa?
Sure.
What's your last name?
Pimentel.
And how do you spell that?
Pimentel.
Thank you very much.
Thank you so much. Give a big hand up for Vanessa. From Vanessa, you have heard a first-hand account of what happens when you put e-cigarettes out on the market and how they get in the hands of young people. And now we are going to hear from Christine Chasson, who is with Parents Against Vaping and E-Cigarettes.
Woo!
My name is Christine Chesson, and I'm a San Francisco mom of 3. I'm part of a grassroots movement of parents across the country working to halt the explosion of non-FDA approved e-cigarettes such as Juul that are creating a new generation of nicotine and tobacco users. My own son is now being treated for nicotine use thanks to Juul's aggressive and predatory campaign to grow a brand new customer base for its addiction business. Kids in San Francisco have told us that up to 80% of their friends are regularly using e-cigarettes. It's normal, everyone does it, they say. Big Tobacco has snuck back into the addiction business through the tech industry's side door, luring millions of teens and young adults down this profitable path. Juul Labs has refused to submit their e-cigarettes to the FDA for approval, where their toxic ingredients and predatory marketing plans would be reviewed for public health and safety. What are they hiding? Companies, including Juul, are now trying to buy influence with local organizations and clubs including the California Democratic Party, using the millions of dollars they're making in the addiction business. How many young people are they addicting? A recent study cited by UCSF found that for every one adult that makes the switch from smoking to e-cigarettes, 80 young people, 80, between the ages of 12 and 30 will start using tobacco daily through e-cigarettes who would not have otherwise started. 80 new addicts for every one adult switcher. This isn't just bad for my son, this is bad for an entire generation, and a price we should not be willing to pay. Thank you. Woo!
Thank you so much, Christine. We are not going to let big tobacco co-opt our young people. We are not going to let big tobacco come back disguised as a product that is actually helping people, but is even more addictive than cigarettes and a pack of cigarettes in some cases. And I am very sick and tired of people pushing and peddling products that are harmful to our young people.
But it's okay to keep cigarettes.
And
on
we
the
are
shelf
going
now?
to make sure that people who sell nicotine products,
go back
that
to a
people who
cigarette?
are focused on harming our children,
I've been
people
off
who
cigarettes for almost 6
people who
years.
put
Now you wanna go
profits
back on a
before
cigarette?
the health of our young people
That's the
are
only
the
thing
people
that
we are
matters.
going to make sure that don't have these products. And we are going to fight them to the very bitter end. No matter how much noise they make as businesses disguised as tobacco peddlers, we are going to fight them head on. Today, we will meet to hear our ordinance on banning e-cigarettes and ending the practice of targeting our young people at our Public Safety and Neighborhood Services Committee. I want to thank City Attorney Dennis Herrera for his courage for co-authoring and co-sponsoring this ordinance. I want to thank all of the people who came here today to demonstrate and show how much we are not scared to fight big tobacco as we have done in the past with any big company or any big sector that has been attacking our children. I want to thank the American Heart Association, the San Francisco Marine Medical Society, the San Francisco Tobacco Free Project, Parents Against Vaping and E-Cigarettes, the Center for Disease Control, and all of the speakers today and advocates that have been working to stop putting our young people in a position for a lifetime of addiction. Despite the progress reducing smoking, tobacco use remains the leading cause of preventable death in the United States, killing more than 480,000 people each year in many forms of cancer, heart disease, respiratory diseases, among other health disorders, which are more than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. According to the Center for Disease Control and Prevention, the number of middle and high school students, our babies, who reported being current users of tobacco products increased 36% from 3.6 million to 4.9 million students between 2017 and 2018. We have fought so hard to reduce the use and consumption of tobacco since we passed Prop 10 in '98, putting out education, stopping addiction to tobacco, stopping addiction to nicotine. Then you come with these products disguised as memory sticks and you sneak them into our young people. According to the CDC, e-cigarette usage among high school students increased 78% during those same 2 years. And 1 in 4 high school students have used tobacco products. Given the rates among youth, the known lifelong effects of related tobacco use, and the potentially harmful effects of vaping systems, it is more than prudent to control the use and accessibility of such products, particularly because they have not gone through the FDA trials for approval of how they are marketed and have not been determined safe for use. That goes for young people and adults. As it stands, the FDA right now is carrying out a national survey on the effects of e-cigarettes on youth and even considering an outright ban on electric nicotine delivery systems in general. And we are going to do it here first in San Francisco. Our legislation states, until the due diligence is carried out by the FDA concerning big tobacco companies like Juul's marketing to our youth, those products will not be sold here in San Francisco. Companies like Juul have had 3 years to submit their product and marketing to the FDA. And the question is, why haven't they? The answer is because these products are harmful. Nicotine is harmful. It actually kills people. And our youth and our health are under attack. Please join us in protecting our youth from a lifetime of addiction. Do not buy into the statements that vape products are harmless to adults. And remember, Juul is spending thousands of dollars here in San Francisco, trying to buy our Democratic clubs, trying to buy our consultants, in the very name of making profits over the health of our young people. I don't care where you stand in terms of your habits as adults. I am never trying to stop people from doing the things that are legal and that they're allowed to do. But I would do anything and everything I can to protect our young people. So when we are attacking young people, when we're marketing products on social media, when we're marketing products directly to young people, when our children in middle school and high school are now becoming addicted to nicotine at a higher percentage than they were 5-6 years ago, then we are going to come after the very companies and the products that are doing that to our young people, and we're not going to stop until we prevent that. So please join me in fighting for our young people. Join me in fighting against profits that attack our young people, and make sure that we keep our children healthy, keep our adults healthy, and fight against these products that are harmful to everyone. With that said, I want to bring up Maria Olson, the Senior Vice President of the American Heart Association for the Bay Area.
Thank you. My name is Maria Gonzalez Olson. I am the Senior Vice President of the Bay Area Division of the American Heart Association. I stand here today with thousands of volunteers, caregivers, and survivors, and a board of extremely active and passionate board. Together, we are united in our efforts to protect children and youth from the harmful effects of e-cigarettes. Whether it's delivered via traditional cigarette or an e-cigarette, nicotine is extremely toxic and addictive. The evidence is mounting that flavorings used in e-cigarettes are harmful as well. In fact, one of our board members from Stanford recently released a study just last week that found that cinnamon and mint flavorings were particularly harmful. The study also showed that even in the absence of nicotine, e-cigarettes liquid flavoring may increase the risk of cardiovascular disease when inhaled. The amount of addictive nicotine in 1 Juul pod is equivalent to that of 20 cigarettes. Many teens don't even realize they contain nicotine. Some scientists have likened flavored tobacco as the, quote, brain poison, end quote, to teens. Our children are becoming addicts. On a personal note, after experimenting with a variety of fun flavors her junior year in high school, my youngest, my baby girl, became addicted to vaping her senior year. Ironically, it was the same year my stepmother, Elizabeth, lost her year-long battle to lung cancer. Elizabeth died at the age of 60, 2 days after her birthday. My daughter Emily and Elizabeth were extremely close. Thank goodness that catapulted her desire to tackle that monster. The science clearly dictates our stance on public policy priorities. We wholeheartedly support the policy that San Francisco residents voted for last June to restrict the sale of flavored tobacco products. To strengthen that mandate, we further support restriction of non-FDA approved vape products within the city and county of San Francisco. Ending the sale of non-FDA approved e-cigarettes will protect our communities, and particularly our communities of color, which continue, in addition to youth, heavily targeted by tobacco companies. The American Heart Association respectfully asks for your support in this vital public health policy. Thank you for your time and consideration.
Thank you so much, Maria. You know, it just dawned on me that we have people in this room who have been fighting to continue the negative effects that are happening to our young people. And like I've told them in those small rooms when I've met with everybody who wants to attack our young people, I'm gonna tell them on camera, I'm gonna tell them in front of all of you, that we are gonna do everything we can to stop the harm of our young folks. No matter how loud you are in this room, no matter how loud you are outside, we are going to be louder and be more effective in our communication. With that said, I want to call up Dr. Stanton Glantz from the Center for Tobacco Control, Research, and Education with the University of California, San Francisco.
Well, thank you for having me. It's a real honor to endorse this very sensible proposal. All this ordinance would say is that you can't sell e-cigarette products in the city and county of San Francisco until the manufacturers have submitted the paperwork they need to send to the FDA to get them approved as, quote, appropriate for the public health, which is the standard of the law. The FDA took jurisdiction over e-cigarettes in 2016. Juul could have submitted an application to sell their products 3 years ago. The FDA committed to review all applications within a year, 3 years ago. So if Juul had submitted an application in a timely manner, they might well be approved right now. And if they ever got around to putting in an application that demonstrated their product was appropriate for the public health, they would get approved and under this ordinance could be sold again in San Francisco. But when Trump came in, he took the deadline for submitting those applications and pushed them out to 2022. And Juul and the other e-cigarette companies are simply taking advantage of the fact that Trump is not letting the FDA enforce the law. Now, a couple of weeks ago, a federal court in Maryland ordered the FDA to start enforcing the law about e-cigarettes, and the FDA is fighting that. So all this ordinance is doing is basically calling the FDA and Juul's bluff and saying, if you really think you can demonstrate that these products are better for people, then muster the scientific evidence and put it into the FDA and get a product authorization order. And that's something, as I say, they could have done 3 years ago. Now, I doubt that they'll succeed when they do it, because just yesterday we published a paper showing that people who use e-cigarettes are almost as likely to have heart attacks as people who smoke cigarettes. Others have shown they're almost as likely to have lung disease. And there's now even emerging evidence for cancer. So I think, in a way, Juul made a big mistake in not putting their application in 3 years ago, because all this evidence of heart attacks and strokes and lung disease wasn't around back then. And again, what Juul is trying to do is take advantage of the Trump administration's refusal to enforce the FDA law. And what San Francisco is doing is just saying to the FDA and to Juul, well, we can't make Trump enforce the law, but until the company and the FDA follow the law, we're not going to let you sell these products. And Juul could have come into compliance 3 years ago had they wanted.
Thank you so much, Dr. Glantz. When you come from communities of color, most of the negative health outcomes affect you disproportionately. And in some cases, we don't have the same access to transportation. We don't have the same access to grocery stores or quality produce or quality healthy groceries in our community. And so we rely on some of our smaller grocers and some of our neighborhood stores to make sure that we get the products we need because it is hard sometimes to navigate in a big city. But we demand from them the same thing that we demand from any vendor. We demand from them to make sure that what you sell in our communities is going to be a benefit to our community. We demand from them that your presence in our community be a benefit to our community. You don't have the right to sell harmful products at will and do it in the name of small business. See, I've been talking to small businesses, and we're going to work to do some things to help them increase their revenue with the ban. We're going to work on some things that are going to directly be positive and have a positive effect for our small businesses. But you don't get to say, I get to sell products that just harm your community.
That's right.
We're not going to stand for that. And I want to be very clear with that message and very consistent with that message. With that said, I want to bring up Dr. Jeremiah Mock from the University of California, San Francisco.
Thank you, Supervisor. Thank you, Supervisor, and welcome, and I appreciate the opportunity to be here today. I'm a professor of public health in the University of California, San Francisco, and I'm also a member of a community-based coalition in Marin County called Marin Healthy Youth Partnerships. Marin County is undoubtedly one of the epicenters of dual use in the country. We have extremely low youth smoking rates, below 5%, and in the last 3 years we've risen to self-reported rates at 11th grade of between 28 and 30%. San Francisco is our neighbor, and we're here. I'm here today in solidarity with the efforts in this city. The city's efforts to ban flavored tobacco products was respected and followed almost immediately with an ordinance that was passed unanimously by the Marin County Board of Supervisors, and we've had subsequent jurisdictions, including Corte Madera, Larkspur, and San Anselmo, that have passed ordinances. We are on track to become one of the first counties. We are on track to become one of the first counties in California to have all jurisdictions pass ordinances banning flavored tobacco products. And we think this move from San Francisco sends a signal in the next step in the right direction. So I've conducted research with colleagues and students at 12 Bay Area high schools to look at the impact that our supervisor is concerned about what is going on with vaping. And we in particular are concerned about the environmental impact of these products because they are harmful. They leach toxins into the environment once they're disposed of. And unfortunately, they're not, in many cases, being disposed of properly. If you look around the streets of San Francisco and our communities, you will find Juul pods and Juul caps, just like you will find cigarette butts on the ground. This has been a very serious problem. I'll just show you very quickly. This is what the internal components of a Juul device look like. They have toxic metals. They have lithium-ion batteries that are harmful for the environment. This is an unrecyclable product right now. It was never designed with the intention of it being recycled easily after use, and people throw them away once the battery is no longer rechargeable. This is what the components of a Juul pod look like. They contain metals, they contain plastics. As we all know, San Francisco has been a leader in banning single-use plastics, including plastic bags and straws, and we find these items everywhere. I've conducted research not only in high schools, but at public beaches and public parks all throughout the state, and we're finding waste there as well. This is an intern who has worked with me on picking up Juul waste in the parking lot of her parking lot of her school, and I can tell you that she, like many students, are completely fed up with the fact that we as adults have not taken responsibility for controlling the access to these products, and their schools are inundated. It is destroying the school culture. Teachers are inspecting kids all of the time. They feel like they're being observed and hassled, and they're exposed constantly to secondhand aerosol when they go into classrooms, or where kids are smoking and vaping and blowing out the vapor in their sleeves, or when they are in the bathrooms, the cafeterias across the campus. And you know what happens with waste when it's thrown on the ground in the bay? This is what happens. It goes down storm drains, right? And it all drains into our bay and into our environment. This is what happens when you see jewel pods that deteriorate. We collect these, and this is what they look like when they get crushed up and turn into waste. And they leach out the solution that's in them. And you can find them easily on the ground. So I want to show you what we've collected. For anybody that disbelieves that this is a problem, this is a bag full of waste from one high school collected at just one time, only in the parking lots and the perimeter areas. And here's another one with the plastic packages. And here's another one. And let me tell you that we find jewel waste together with cigarette butts, which is a very strong indication that these two habits are going together. And we know from evidence that people who start jeweling often end up migrating into cigarette smoking, and that is very detrimental for the success we've had in reducing cigarette smoking. And for our friends who feel like they need to use a jewel, I sympathize with you. It's a very addictive problem to deal with, nicotine addiction. But we have products that are FDA approved that you can buy over the counter that will help you stop with and control your nicotine addiction. There's more plastic and more waste, and it goes on and on and on. And this stuff damages our environment. So I urge the Board of Supervisors to ban all of these products.
Woo!
Big Tobacco will tell you these don't get in the hands of our young people. Or that it's not their fault that they're getting in the hands of our young people. Well, if it's not Big Tobacco's fault, if it's not Juul's fault, if it's not the fault of the people who sell these products in our city limits, whose fault is it?
The parents' fault.
This is a clear indication of why we need to shut e-cigarettes down here in our city and county of San Francisco. Thank you so much, Dr. Mott, for bringing the demonstration and showing in front of everybody the evidence as to why this legislation is so important. I now would like to bring up Dr. Thomas Aragon with the Department of Public Health. Thank you.
We currently are in a public health crisis, nationally and locally. My name is Dr. Tomas Aragon. I'm the health officer of San Francisco. I was born and raised in San Francisco, and I raised 3 children in San Francisco. I come from the Mission District. That's where I'm from. My dad was addicted to cigarettes, and my mom died of lung cancer, squamous cell carcinoma, from secondhand smoke. The study that she was referring to is even worse than what she was talking about. Let me tell you why. These were researchers that looked at the current situation, the current evidence, and what they found is that for every individual adult that quit smoking cigarettes from using electronic cigarettes, 80 youth and young adults would go on to become regular cigarette smokers.
Oh my God.
Regular cigarette smokers, okay? That means that if you imagine we have 2 piles here, on top of the pile, we have a pile of people who are addicted to nicotine. This is a nicotine addiction industry. The people who are smoking cigarettes is just the tip of the iceberg. By keeping these products the way they currently are, this is the trade-off that we have to make as a society and as a community. Everybody here, this one is a no-brainer. We need to protect our youth, and we have ways to take care of adults. It's called FDA approval. We get this approved through FDA so that adults can have safe access to approved products so that they can work their way down away from being addicted to cigarettes.
Aren't cigarettes FDA approved?
No.
No, they're not.
The answer is no, and this is an example. No, this one is really easy. Thank you so much, Shamon Walton, for your courage.
The fact of the matter is this: nicotine kills. Nicotine kills in the cigarette. Nicotine kills in the vape product. So for people to disguise one product for another, or to trade one addiction tool for another, it's ridiculous. And we're not going to sit back and try to buy the fact that you're going to use a different device, a different product, to still ingest the same amount of nicotine into our community. And again, we're going to fight that to the end. I now want to bring up a leader in this city, a delegate to the California Democratic Party, Ms. Henny Kelly.
Let me just tell you something. I'm a grandma. Don't you mess with grandmas. When you say you're having Juul is to help people get off of cigarettes, then why do you take 35% of what you use to make these damn things and take cigarette money? That is what you are doing. You are going to Democratic clubs. Well, let me tell you something. You're not going to get in, because every Democratic club in this city is going to join me. I have made a pledge to bake 10,000 challahs to get Juul out of the Democratic Party. And when I finish with 10,000 challahs, I'll bake 10,000 more. Now, people don't really all want to bake challahs, so some of them are making tacos. Tacos are pretty darn good. I think it's an important thing that people make the rules, not corporations. That's right. And I will tell you that Juul is bad business. Juul is tobacco business. And you have listened to people who have a lot more intelligence than I do and can give you all the facts. But you know what you learned today? This is what we know. Juul has got to go. Let's hear it. This is what we know. Juul has got to go. This is what we know. Juul has got to go. This is what we know. Juul has got to go. And let me just tell you that this isn't a joke. I have 3 grandchildren. I would do anything in the world for them. I'm going to teach them how to bake challah. But I'm not kidding about this. It's our job. It's our job. We are the people. This lovely gentleman is a public servant. He serves us. And he is going to make sure that the city serves us too. So get with the grandma. I will be putting these up for sale later. They are going to be $10 a loaf or whatever you can give. And that money will go to stop Juul, not just here, but to stop Juul in California. Thank you.
So I want to make a plea with everyone. And the first plea is to make sure you go out, and when these collars are for sale, you start purchasing collars. Because here's the reality. Big corporations are spending a lot of money trying to infiltrate our Democratic clubs, spending a lot of money trying to pull our consultants together to fight what? To fight the safety of our children? To fight the health of our communities? The last thing I just want to say is nicotine is nicotine. Whether it is in a cigarette, whether it is in an electronic device, it is still the same murdering chemical that it has always been for years. And we all need to remember that. And so our job here in San Francisco is to make sure that we do everything we can to keep harmful substances out of the hands of our young people, out of the hands of our communities, because that is our job, to protect our young people. Thank you.
Here's what we know. Juul's got to go. Here's what we know. Juul's got to go. One more time. Here's what we know. Juul's got to go. Woo!
We want to thank everyone for coming out, and we're asking that everyone please head into the chambers. We have a few minutes for a few questions from the press. So if there are any press questions,